everybody. Welcome. Very happy to have you here. My name is Mary Jane Burke. This is Dr. Lisa Santora, our public health partner, and we're looking forward to updating you on what we need to do to get ready for back to school, which is starting for some districts as early as next week. And so we look forward to answering any questions that you may have, but more importantly, providing you with the most up-to-date information. One of the things for you to be aware of, this session is sent out to go to school leaders. So this includes school leaders, whether you might be a principal, superintendent, in some other role in your school district, or one of our labor leaders. So very happy to have you and welcome. So if we could go ahead and start with the presentation. All right, so let's start with context, and just as a reminder that in Marin County, we were of the first in the state and the country to actually open schools successfully. And at the end of the 2021 school year, we had 100% of the schools were offering in-person instruction. And then when I say the schools, this will apply to public, private, independent, and parochial schools. This next slide provides you with some information about the data that we collected over the period of last year, and want to assure you first and foremost that we'll be doing the same this year. You'll be getting information related to our status. We will also have information available through the county-wide data system. So you'll be able to collect and see data there. So we'll continue to collect data, but just to note that after close to 3 million student days, there were just 19 in-school transmissions. But as you look at this, you can see that there was a jump from May to June, and Dr. Santora is going to talk to you about what happened at that time that made a shift in our information.
So thank you again for being here today. I am so excited that school's about to start. I always say it's the most wonderful time of year for parents. It's a great commercial that I remember when I was a kid. So thank you again for all you did for a successful year last year. And it is one of my proudest achievements is the reopening of schools in Marin County for all of our kids and safely doing so. The first thing to notice is that we're not going to be in the same tiers as we move into the next school year. We're beyond the blueprint, so you're not going to be seeing purple anymore, except if it's a purple air day. And what happened though in April is that we saw the Delta variant enter into our community. And so we saw best practices keep the Delta variant at bay. And then in June, we had an outbreak at one of the schools that probably most of you have read about. And it was connected to unvaccinated staff. As we've seen, it proved how transmissible and contagious Delta is. So we had a jump and seven persons at the school who were infected probably at the school setting. And so this is where we are now. We're managing a new variant. We're all back to wearing masks again, as we're indoors in these indoor settings. And that's just another layer of protection that we have to open our schools and to keep our schools open. And I think it's just really important to remember that we've created a strategy that's been successful by having multiple layers of protection that start first with having low risk activities at home, and then just not showing up to school when you're sick. So we're gonna dive more into that, but I think this is what we learned is that Delta is here. We have to modify some of our behaviors, but we're ready to take on the challenge.
Okay, so just to add a little bit of context as a reminder, the first public health guidelines were issued June 18th of 2020. We knew at the time, and it was outlined clearly, that we would expect that COVID would be evolving and would result in changing the guidelines. And so, as you may recall, that our guidelines from June 18th were revised on August 12th, December 8th, and March 23rd. So we continue to evolve those guidelines. We want you to expect that again as we begin this school year. But the result was that the guidelines did provide us with what we needed to ensure that we could open school for kids safely and for staff. And what we provided was a structured, supervised, and protected environment. So today, for your information, reflects the 4th update of the original version of those guidelines.
And I would just add that we are going to see how the Delta variant behaves in our school settings with these extra layers of protection, and we will adapt and potentially either be more restrictive in the guidance that you see today, or hopefully less restrictive as we see more people vaccinate in our community.
So what we know, as I mentioned, is that the guidelines will continue to evolve, number one. Number two, when you see the framework for today, you'll see it keys off of the original 30-point plan. And there are some of the guidelines that are not currently applicable, i.e. you don't have to have a specific route for the students to come onto the campus. However, as a reminder, a school or a district could essentially be more restrictive than the guidelines will be showing, but they could not be less restrictive. Also, mitigation strategies may shift, i.e. we may start with wearing masks indoors, but it could shift to masking being required indoors and outdoors based on public health guidance. And that vaccination rates among adults and students, which we'll talk more about, will be critical in that ultimately, in the case that there is high vaccination rate, which I think can expect in most of our schools in Marin County, that might actually affect the mitigation strategies. So we'll have that to look forward as we collect that data. Okay, Lisa, are we able to get vaccinations?
Oh yes, you can get vaccinated anywhere. We're really excited to see an uptick in vaccination in our community. We have had very busy mobile vaccine clinics. They got a little quiet during the summer, so our staff is ready to vaccinate you. You can go into almost any pharmacy and get vaccinated. And then we're also prioritizing the deployment of our mobile vaccines, so public health mobile clinic, to parts of our community where we think we can be conveniently located for the under-vaccinated population. So, and time to get vaccinated. All right, so this is our student and staff vaccination verification. Cdph, our California Department of Public Health, updated its guidance that we need to know the vaccination status of our school community. And so this is going to be another measure that supports the safer environment that we aim to create for all students and staff as we enter the school year. It also will support families as they can see where the vaccination status is in our community, and again, it will inform our mitigation strategies. We're optimistic that as we see higher vaccination rates in some school communities, that we can be less restrictive and shift away from some of the guidance to create what used to be, not the new normal, but going back to what used to be the old normal for us by having less restrictive environments. All right, so this is a long statement, so I'll just read it, and I know everyone can read, but we are seeing that all eligible students and staff, if you haven't heard the message, should get vaccinated as soon as possible and should verify their vaccination status. Staff that aren't vaccinated should be tested weekly. We are going to be posting the vaccination rates of students and staff alike, and so people in the community can see our vaccination status. And just to be important, we are committed to protecting the privacy of individuals. And so it's not going to be individual vaccine records posted. It's just like we have with shots for schools and other vaccines. We have publicly posted our vaccination rates. And testing is widely available in our community. We are excited to see more people testing. Again, we'd like to have both our vaccination centers busy as well as our testing centers busy. The good news is that not only are there these resources in the community around testing, we are partnering with the state to offer testing at the school site. So we've been working hard this summer to pilot school-based testing and getting some schools online. and with a testing program that's supported by the state, and again, with the goal is having testing widely available, which is very different than last summer. If you remember last summer, we had long waits for test results, so it's a lot harder to battle a pandemic when you can't even get a result of a test. And that's not the case anymore. There's widely available testing. Public health will continue to evaluate it to see if we need to increase testing capacity and support that. But right now, we're confident that we have enough testing resources to support the community's needs. Face masks. So our big change. I am personally not a fan of the face mask. I love seeing people's smiles, and I talk with my hands and my mouth. So, but that being said, we collectively in the Bay Area health officers made the decision to issue an order that requires face masks indoors. It was not a major change. It was already recommended that all vaccinated and unvaccinated persons should wear a mask indoors, but due to the increasing number of cases and our concern around the hospital capacity, we added this additional measure to require indoor mask wearing in public settings by both vaccinated and unvaccinated individuals. And that's because it's common sense. If I were talking right now, there would probably be some respiratory droplets that would be coming out of my mouth. And wearing this mask prevents that from happening. It stays closer to me, so that's called source control. And we also see that masks also provide some protection to the individual that's wearing it. It's not the main reason we wear it. We mainly wear it so we don't infect others, but you also offer some protection by wearing a mask. We hope this is a short-term strategy. We're going to be looking at the data. Once we confirm that our hospital capacity is intact and that we are not at risk for medical surge, then we'll probably end the order. But it's important to remember, once we end the order, if it's ended during a time when we're considered at high or substantial transmission, it's still expected that everyone should wear a mask, whether they're vaccinated or unvaccinated, based on CDC recommendations. And so the guidance right now is the order is for indoor public settings. So you do not need to wear your mask. I'm the first one to take the mask off after I pick up my coffee. So while you're outdoors, again, I have a new mask and I don't like how it fits. While you're outdoors, you don't need to wear a mask. There's in public settings, but we'll talk about the school setting later. So this is just some updated CDC guidance. Because of the Delta variant, the CDC did update their guidance. I think the most important thing why it's in bold is because we know that there's end of summer vacations that are happening. And it's very important for parents and staff alike to know that if they are unvaccinated, and that means if it's a vaccinated parents with unvaccinated students, that they will need to quarantine for a full 7 days after travel. So if you're starting school on the 19th, you need to be back in town by the 12th, so you can have a full 7 day of quarantine. So, and then also you should be getting tested 5 days after that travel. That's why I think a lot of parents have to just check their travel plans and make sure that they have that quarantine intact. Then also changes that vaccinated persons now are recommended to get tested 5 days after they return from international travel and to monitor for symptoms. Previously, if you're vaccinated, there's no recommendation for testing, but with the increasing proportion of Delta variant seen in vaccinated persons, recommendation is now to get tested. So the school CDC also recommended universal indoor masking for all teachers, staff, students, and visitors, regardless of vaccination status. And then in Marin, like I said, we strengthened that recommendation and made it an order. And then also, this is a new change. If there's a known exposure to COVID, really do need to adjust this mask. Both vaccinated and unvaccinated persons need to be tested 3 to 5 days after exposure. In the past, if you were vaccinated, it was not recommended for you to get tested, just to monitor for symptoms. Now we're recommending that you actually get tested after you've had an exposure.
Okay, so this chart provides you sort of a simple way to look at how things will be evolving related to the guidance that we're about to share. And so we're calling it the ABCs of Mitigation Strategies. And as you can see, there's no mitigation strategies required, and D would be the most restrictive. So B would be universal masking indoors with symptomatic testing, and then C, masking indoors and outdoors, and then D, masking indoors, outdoors, and then beginning to implement again stable grouping strategies, i.e. The entire school would not be able to be out on the playground, but rather 1 or 2 classes at a time. So that would be the sort of the way that things will evolve, and just note that these arrows go back and forth. So we are aware that things could change to be more mitigation or less mitigations, but the basics, good hand hygiene, get vaccinated, and stay home when you're sick. So those become, I think, the ABCs that when those are followed, in fact, in the case that Dr. Santora mentioned, when there was an outbreak, we had both no vaccination and someone who didn't stay home when they were sick and didn't wear their masks. So we had several issues that came into play that then led to students getting COVID from their staff member.
And I just want to put an exclamation mark on staying home when sick, and also to get tested if you're feeling sick. So we're seeing that the Delta variant is presenting with some more mild symptoms in many people, especially if you're vaccinated, that you might just think that you have allergies. So if you were in a higher risk setting, for example, you're indoor with a private gathering mixed with vaccinated and unvaccinated persons, and you weren't wearing a mask while you were indoors, and then just a couple of days later you develop a scratchy throat, we would recommend that you get tested, and not just to attribute it to your sinuses. So I think that's another key thing, is stay home when you're sick. There's plenty of options around testing, and like last year, get tested, and that'll provide the reassurance that you need that you are not infected.
Great. Okay, so at this point, do we want to take a few questions before we jump into the guidance? If we could go ahead and do that. So who's got those questions?
Mary Jane, we've got a question. Will vaccinations be required for students 12 and up or staff? And will teachers and staff at schools know if their students are vaccinated or not?
So vaccinations are not yet required. This is something that's evolving very quickly with as rapidly as the Delta variant is surging. And the second question is around knowing the status. At this point, we do not anticipate that we would be releasing individual vaccine status. We're going to be sharing group vaccine status. Typically, though, once there is a case, the first person we talk to is staff and teachers to identify who had close contacts or not, and we'll be reviewing the vaccination status of both students and staff who were identified as close contacts, because that does affect their quarantine recommendations is based on their vaccination status. Felt like there's another part to that question that I missed.
No, I think that's it. And then the next question is, how will staff verify their vaccination status?
So we are learning that now. Each school and school district will be looking at the systems that they already have in place. So for students, we have systems like Shots for Schools, where we have certain required vaccinations. We're already in communications with the state to see if they'll be adding COVID vaccines, so we can use the same tool that already exists. And then our HR departments in all of our schools and districts also have systems for documenting important health status information like TB status, measles, mumps, rubella vaccine. So this is just adding to the same systems that are already in place for reporting. The state has issued new guidance on what's considered required for vaccine verification. So most of us have the card that we got when we were vaccinated. You also can go, we can make sure we share this publicly, the state, and it actually works. You can go online and get your vaccine information downloaded directly to your phone, and that could be uploaded into any system. So you'll be hearing from your school how they're choosing to verify based on the school's platforms.
And then these two questions relate to the continuum chart. What stage are we in now? And how will the decision be made to move back and forth between levels A, B, C, and D?
So I'd say we're in between B and C, leaning towards C. Again, there's no hard, when you see how we have connected the guidelines to the mitigation strategies, there's no hard cutoffs at this point that we're gonna learn. We know our 30-point guidance worked, and so we're gonna see how we can relax or restrict. Again, our goal is preventing outbreaks in schools. That's our primary objective, and my personal goal is everyone to have a perfect attendance record by the end of this school year. So that's where we're gonna be learning how the Delta variant is behaving when we open schools. So I'd say right now we're approaching C.
Okay.
Yeah.
One more related to travel. What is the definition of travel that requires the quarantine? Would that be coming back from Tahoe or LA or flying?
That's a great question. Right now it's only out of state or international travel. The reality is the activities you engage in by staying in state, like going to Tahoe, could place you at the same risk if you flew to Oregon. But our current recommendations is based on domestic travel outside of your state would be what is considered travel.
Many of the rest of the questions are going to be dealt with in some of the other information we're sharing. So I think it might be a good time to move on to that.
Perfect.
Great.
All right. So I think there's an elegance to sticking with our original 30-point plan as we move to the new ABCs. It allows us to take our best practices, what we learned at work after a few iterations, 4 iterations of this, and apply that as we move forward. So we're going to jump through five at a time and then allow people to ask questions after each set of 5. So the first 5 are really our basics that we have. We're going to adjust to all the changing orders and laws that we see in public health. They're not designed to impose on individual rights. They're designed to protect our community. And so those will be followed. We're expecting that all the health and safety practices and protocols that are recommended by the state and CDC are in place, including face coverings. And I just want to emphasize the attendance tracking. That's our key tool when there is a case on campus to know who was potential close contact during the infectious period. We know there's new students coming back to school and new staff. So we really want to emphasize that training is expected and to be a key part of this. We had summer school all year for our public health liaisons, but we know that other staff are not engaged in that training. So that's something we expect the school to make sure that they have the training in place so their staff and school community are all ready. You can scroll down a little bit. So I mentioned summer school. We have an amazing group of dedicated individuals who go to weekly school at a public health training. I think they all deserve a master in public health, and they are prepared to ensure that the community that we create on each school campus is as safe as possible. And they also have the most information on how we implement our contact tracing efforts so we can quickly identify who needs to be quarantined or not, and to follow our COVID safety plan, which used to be the school site specific protection plan. Now it's the COVID safety plan. And then lastly, we are not in the high phase of disinfecting everything. We've learned that phone lines are not part of the transmission of COVID-19, but we do want people to have enhanced cleaning practices in place and making sure everyone has their hand gel and all the things they need to make sure they can create as clean of a classroom as possible.
Okay, Ken, any questions at this point on the first 5?
Not at this point.
All right, scroll back down to 6. There we go. So if this can be bolded and red, this would be my favorite, most important guidance. It's staying home when sick. This has been with the outbreaks that we've seen this summer and the clusters that we've seen. It typically starts with someone who is sick going to the activity that they should not go to. So we expect both parents and staff to screen for symptoms and to stay home if someone's sick, and then also to get tested if you feel sick, because again, Delta is circulating and we want to make sure, even if you're vaccinated, that you have not been infected with the Delta variant. So I guess it's so good we say it twice that people are expected to stay home when they are sick. For number 7. Number 8 is just emphasizing that you'll cooperate with us to support our testing strategies. We are strongly encouraging every school to sign up with the state school testing program. We will follow up with every school as we start the school year. We know some people are off for the summer. It helps to have these tests available both for symptomatic testing if a child becomes sick during the school day. And more importantly, it helps us to have rapid testing available at the school site to identify cases after there's been an exposure event. So we'll be working with your schools to make sure you're onboarded into that system. We'll be updating number 9. I was hoping to have it updated today. We have 2 decision trees now, one for vaccinated and one for unvaccinated persons. And there's new protocols based on your vaccination status and your mask wearing status. around quarantine. So we'll be updating this section. And then last, and I'll have we pause there before we go through the run of not applicables. Any questions there, Ken?
Yeah, there are a few. Let's see. If a student is sick and has a sibling at the same school, does the sibling need to stay home as well?
No. The sibling does not need to stay at home. This is going to be in someone's reading our minds as we're going through the decision tree. So the sibling does not need to stay at home. The sick person needs to get tested. And for COVID, the exception to that would be if someone's feeling sick and has had a known exposure to someone with COVID, and it's very highly suspected it's COVID, we would recommend keeping that sibling home. And we'll have that articulated in our decision tree.
Will information be provided related to any state-sponsored school testing? If so, when?
It's already available on the Safe for Schools website itself, and we'll make sure that the links are on our own Rethinking Schools website. So if you Google Safe Schools for All, you will get directly connected to the testing resources. If you email COVID-19 schools@marincounty.org, we can walk you through the steps of getting enrolled in the testing program. And it's
I'm sorry. Sorry about that. There are questions regarding number 6. Does this imply that they should be having students/families fill out a daily health screening or questionnaire?
That's up to each individual school. Parents should not, this should be normal practice anyway, that parents are screening for symptoms. I've seen that many schools continue to have an online form for documentation. That's not required. In my opinion, when a parent brings their kids to school, they're affirming that they have screened for symptoms. So it really is based on the school culture, but it's not required to have a platform for online documentation.
Are any districts considering making rapid response test kits available at home?
Yes, we are working with some school districts to have parents, we're focusing on special education parents at this time, where parents can be trained to do the testing themselves at home. This is a pilot at this time. Testing's not complicated, but you do need to be instructed in how to use the card. So we'll be exploring that. There's testing resources available at the state. The state does not lack in Binax test kits. So there's hundreds of thousands of Binax test kits literally in the state of California, ready to support students staying in school.
What's the protocol if a student shows up with a symptom, i.e. a runny nose or other symptoms? Will they need to be placed in isolation room until they're sent home?
Yes, unless they've already been previously evaluated and confirmed that this symptom is a known chronic medical condition. So we would recommend that they would isolate that student, contact the parents to bring them home, and possibly offer symptom-based testing in the school site right there so they can see if they are COVID positive or not.
And then there are a number of questions, I'm not sure if it relates to the items you've covered yet, related to gatherings, indoor and/or outdoor. Can outside rallies or dances happen? Is the ability for parent meetings that might happen on site with large groups, is that going to be allowed?
Yes, at this point, there are no restrictions in gatherings. Again, we will be seeing how Delta behaves. This might be one of the things we do shift if we see Delta behaving badly in the school setting and seeing clusters of cases or outbreaks. That might be something we shift to. Basically, what we're trying to do is align with what's allowable in the community right now under current orders and recommendations to be what's allowable in the school setting. And again, we'll be learning together to see if those events like a seminar for teachers, a parent volunteer meeting, a school dance, they're allowable. These events are allowable at this time. It's just important to know what's the risk. So the risk, if you allow people who are sick to come to these events, the risk is higher. If you allow people to be unmasked while indoors, which you shouldn't do, that's an order you can't do. If people aren't wearing their masks appropriately, the risk is higher. If it's not a fully vaccinated group, the risk is higher. And the more dense it is, if you have a small indoor room with more people, the risk is higher. So this will be one of the things we evaluate as we start this new school year to see if we need to limit those types of gatherings.
I'd like some clarity on whether unvaccinated students need to be tested weekly as well as staff, unvaccinated staff.
We are requiring, if this is not an order, I just want to be really clear, this is not an order. The recommendations from the state, where Marin County is aligning with recommendations from the state that all employers should implement vaccination verification processes and testing of unvaccinated staff. They are not recommending testing of unvaccinated students. We have had pilots across the county and also in our neighboring counties, and screening asymptomatic unvaccinated students does not yield many positives. We still have, youth has its advantages with this virus. When they are asymptomatic, they are generally not carrying this disease, and so it is not recommended for students to engage in screening asymptomatic students at this time. We may learn differently, but at this point, our public health guidelines are to verify the vaccine status of everyone and to implement a testing program for unvaccinated staff.
And then questions related to the number of days for quarantines. For example, is it 10 days or 14 days of quarantine from beginning of symptoms? And did you say that vaccinated individuals should test 3 to 5 days after an exposure, but should quarantine until the test results are known?
Yeah, so vaccinated individuals do not need to quarantine. They need to monitor for symptoms for 14 days, and they should test 3 to 5 days. We recommend 5 days. You'll see 3 to 5 days in CDC language, 5 days after their exposure. Unvaccinated individuals who had a close contact, and I'll jump here. Unvaccinated individuals who had a close contact would quarantine for 10 days. They can shorten that quarantine to completing 7 days if they test negative for COVID-19 on the 5th day and they remain asymptomatic. There's a new addition, and it just supports our emphasis that all students should be in school. Close contacts in the school setting, students only who were wearing masks can have a modified quarantine where they're allowed to go to school. They're going to monitor for symptoms. They're going to get tested 2 times during that 7-day period. And if they remain asymptomatic and they test negative, they can shorten their quarantine to 7 days. That modified quarantine, though, is only for in-person instruction. They're to be excluded from all extracurricular activities, sports, youth groups, all of that they'll be excluded from. Their modified quarantine is only to support them staying in the classroom during their quarantine period.
Okay, so a number of the questions are for items down the road a little bit on the chart, including number 31, which has a lot of questions. So maybe it's time to go back to the chart.
So this is our first run of 5 that are no longer currently applicable. Again, these, if you look at the language, it's very similar to how we ended last school year, and this is what we are easing up restrictions as we start the new school year. So we no longer have physical distancing requirements. Universal masking is supporting the end of physical distancing requirements. We've seen the mask be very effective at preventing transmission, and if everyone follows the ABCs, especially not going to school when sick, we're confident that this will support everyone staying in school. We no longer have the stable groups where we only allowed 1 classroom grade to stay together for the whole school year. Classrooms are allowed to mix. If there's mixing, though, we just need to have good attendance. So that's why attendance is emphasized on one of the earlier numbers. With the middle schools, we expect that students will be able to move to their classrooms as normally and go through their hallways as normally. And so that's not currently applicable. The next one is when we started the return to school, we said all the desks need to be so many feet apart, face forward. That's not longer currently applicable. All students just need to be wearing their face coverings. And then 14, this is when we were concerned trying to keep 1 teacher or staff to 1 group. that's no longer required. So you can have co-teaching of classrooms. And lastly, before we give a pause for questions, we used to try and have very structured routes of entry into classrooms. And if you go to many of our school spots, you can still see where X's are 6 feet apart. That's no longer required. Again, schools may opt for any of these that are not currently applicable. Schools may still opt because it worked well for their culture and their community to keep these guidance in place, but they're not recommended. Anything before we jump to the next slide?
Just some clarity on what exactly not currently applicable means.
So this would be, for example, we may see that if we're having higher rates of cases, we might say we want to just have stable groups. So we might say, well, 15 now is recommended. So what I would say in the next version is say we had to update this, not currently recommended, not currently applicable would become exchange for the word recommended or recommended. So what it means right now is you do not need to implement those measures as you start the school year, but be prepared that if we see any concerning COVID activity in the school setting, we might recommend the reinstitution of some of those more restrictive restrictions.
Regarding vaccination and requirements, is there any talk about boosters being needed or required in the near future?
There's talk about it. We right now are waiting for science and data to inform our policy decisions around boosters. What we in Marin County would wait for is for one, emergency use authorization for any of those vaccines to be offered as a booster. So any supplement that's being afforded right now is an off-label use of such supplement, so vaccination. And then we would want the ACIP, which is the Advisory Committee on Immunization Practices, and Centers for Disease Control to recommend that booster. They are reviewing this, they are looking at data. Data yet is not compelling of the benefit yet, the big yet in bold of the booster shot. So when CDC does recommend booster shots and what is the exact recommendation around that booster shot, that's when Marin County would shift its policy and offer a booster and recommend booster shots.
Okay, I think a lot of questions will continue to be answered as we move on.
All right. So this, so now 16 through 20, still we're in the not currently applicable. 16 is when everyone was orchestrating arrivals and recess, all strategically. It was a master degree in orchestration that school staff completed last year to minimize close contact. That's no longer required. Again, the hallway movement I described for the middle and high schools is really, you're trying to control traffic. There was a lot of air traffic controllers out there that got a lot of upper arm exercise, trying to direct traffic. That's no longer required. And then we had school assemblies, or those large gatherings were prohibited. This one is, okay, so the applicable, sorry, this one we're trying to make it again as consistent as possible. So in the beginning, we tried, when we started school last year, we tried to encourage all schools to see the outdoors as their school setting. And we, again, this is a time we didn't know much about COVID-19, and some schools really were visionary and moved their classrooms outdoors. So that's no longer applicable. We want students now to be in the best environment and setting for learning, which for most students to stay focused is indoors. What is applicable though is that we want to emphasize the importance of maintaining high air quality, especially as we prepare to move into wildfire season. So that's 19. And then 20, this goes back to phone mites. It is not seeing that you're going to get COVID-19 by touching other things. So in the beginning, we didn't know. So we said we couldn't have shared playground equipment. Kids couldn't climb the spiders. Now kids are allowed outdoors and playing on all the equipment they want, and they can share basketballs and play as normal. Any questions there?
No.
All right, so now we come into a mix of what's not applicable and applicable again. So 21, this is when, again, we're trying to support schools with more physical distancing. So using gyms and other spaces for classroom settings. So we're not recommending that now. We're recommending that students be in their classrooms. We still encourage meals to be served outside as much as possible. When you're eating, you're often projecting droplets. So if you can be outside, that's great, but you don't need to, you can now use your cafeterias and dining rooms for eating. We always describe how kids bunch up. Ideally, the number of kids at a table would be what the factory recommendations are for the number of people that should be at that table. And we do recommend minimizing the time for eating and not wearing their masks. And then this is not applicable anymore. Before, in the beginning, and this is not to understate the critical importance of hand washing. Hand washing is super important, and I think it's our number 2 recommendation is making sure everyone has the supplies they need to wash their hands, and soap should be available, and go around and make sure all of your hand gel dispensers are filled, but you do not need to change schedules to make sure that staff wash their hands at staggered intervals. Everyone can wash their hands as they normally would. This number 24, this is why I'd say we're closer to C. We're entering the school year as of August 4th that we are recommending wearing masks just like we ended last year, both indoors and outdoors. I know there's a lot of parents who really will be disappointed in hearing that, but at this time with the Delta variant, with starting a new school year with new staff and new students, we believe the best thing to start the school year is a bit more conservatively and having students wear masks indoors and outdoors. That being said, there's exemptions for students who have behavioral or medical contraindications or exemptions. And then we understand that the littles often, it takes time for them to learn how to wear a mask. So we want there to be just a supportive environment for the TK through 2nd grade to learn how to wear their mask while outdoors. This would be one of the first things we'll be looking forward to, though, is allowing students to be outdoors without their masks on. And then number 25, training. We all need training. I obviously need training. When you do get a new mask, you make sure it's a good fit. Our biggest risk is when you're touching your face. So remembering you're adjusting from the sides, you're not adjusting from your nose, everyone. And then wash your hands when you can after touching your mask. Anything before we jump to the next 5?
Yes, regarding meals. So no distancing is required for meals inside or outside. Is that correct?
We recommend distancing. Again, kids shouldn't be bunched up eating together. That's if they're bunched up and huddled eating together, then there is a higher risk of disease transmission if someone is infected with COVID-19. Again, there should be a low risk that there is someone infected with COVID-19 because they haven't come to school sick. But we want students to maximize their distancing and sit at tables or sit outside if possible, but there's no minimal distancing requirements. But we wouldn't encourage them sitting just in a circle eating together.
Will desks, chairs, furniture have to continue to be sanitized in between classes? And what is the definition of sanitation?
No, they just need to be cleaned daily as they normally would. Probably what happened the year before COVID is desks weren't wiped down on a daily basis. And so what we would recommend is just daily wipe downs of desks and chairs, but they don't need to be sanitized. They could just be with, if you want to be environmentally friendly, use Windex and a rag. Sorry, I don't mean to support Windex. I make my own combination that I like to use every day, so I'm not trying to endorse anything. But a cleaner in a rag, or soap and water in a rag, or you can use some of the disinfectant wipes, which are less healthy for our environment. I say that for the green teens out there, so I would go with the rag in your own vinegar and water. That's fine.
Okay. There were a lot of questions related to the next sections.
Okay. So this is, again, I guess this proceeds by saying, we didn't know how COVID was transmitted when we started. And we erred on the side of caution, knowing it could be transmitted by fomites. That's when you touch something and touch your face. That's not how COVID is transmitted. It's usually transmitted through respiratory droplets when you're talking, speaking, sneezing, and there sometimes is airborne transmission. Again, that's less common than those droplet transmission. So when we started the school year in the beginning, we said, everything needs to be disinfected, you can't share anything. That's no longer the case. So students can share school supplies. Everyone doesn't need their own individual box that they have to carry everywhere. that can go back to normal, how you manage school supplies and students at their own desks. You can share computers and books and other things. Don't share hats, it might cause lice, but other things can all be shared. We never recommended the use of physical barriers. Science never showed that they were effective. And so I don't think this one will ever come back into play. And so I'm gonna pause there. Any questions on that group before we go to the next one?
No.
Right. So 29, this is where we are requiring non-essential visitors, including parent volunteers, to be limited. We want, especially as we start the school year with the Delta variant, we wanna just be able to know who's on campus and not only have those who need to be on campus there. They should follow all of the health and safety guidelines. And then the expectation is anyone that is not a staff, substitutes, contractors, visitors, or volunteers who work directly with students should be fully vaccinated. Again, this is not an order, but it's a strong recommendation is that that group should be fully vaccinated, just like the staff. And then on 30, I think we saw this before, and this will probably provide that pause. Maybe we pause after this one to answer questions before we go through the last two. All eligible students and staff should get vaccinated. I can't say this enough. If you're over 12 years old and live in Marin County and you don't have a contraindication to vaccination, you should get vaccinated today. If the staff that aren't fully vaccinated should be tested weekly. We are going to publish and it'll be protected. We have policy around not reporting any numbers that less than 10. So there might be some schools that don't report. We know there's some smaller schools out there, so they might not be expected to report publicly because their numbers are too small, but we expect that they'll be posted to their website no later than October 1st, and that they'll be updated on a monthly basis. Vaccination is so important to us because we really see a future where based on the % of people vaccinated on that school, we really can relax some of the restrictions that are in place. And that's our goal. All that being said, the one last thing that we've been seeing is what is expected around sports for vaccination and tests. Again, if you have a student that's over 12 or a coach that's over 12, they should all be vaccinated to participate in sports. It's not an order, it's not required. The outbreaks that we've seen though this summer have been among youth sport groups, has been one of the more common groups. There haven't been many, but that's been one of the more common groups. So, and we right now, since we do not yet have guidance from the state, we refer everyone back to California Interscholastic Federation recommendations and last year's recommendations. We know many of you may be starting the school year before they come out, but that's what we would refer you back to.
Related to 29, the guidelines recommend only vaccinated individuals should be allowed on campus. Is that the same for on-site gatherings of parents? For example, a back to school night, do they need to be vaccinated in order to attend?
They don't, it's not required. We would strongly recommend that you would be using back to school nights as an opportunity to provide outreach and education to unvaccinated families of the critical importance of them being vaccinated. So I think there's two groups. There's kind of school events where parents are coming on campus for a one-time visit for a back to school night. It's not required that those parents be vaccinated as part of their learning, but for the parents that are regular volunteers, it is expected that they would be vaccinated.
Okay, and then regarding number 30, how will our school know how many students and staff members are vaccinated and how do they verify it? I think we touched a little bit on the verification.
Right, so I think that's where we're all in the same boat, looking at our established protocols and software platforms that we already use to verify, again, for TB status and measles, mumps, and rubella status, and the same with schools. For students, we have shots for schools. So we will be meeting with superintendents and making sure principals know how they'll be able to achieve this vaccine verification requirement.
And just to add here, many/most of our school districts have already been collecting this data and will be able to provide specific data about where they are right now in terms of vaccination status.
Okay. Back to you, Lisa.
All right, so 31 is the unknown, I guess. We're still waiting to get the guidance from California Department of Public Health related to youth activities. At this point, we would recommend that you would follow the guidance that was at the end of the year until they provide additional updates. And then lastly, we led the state in creating something called the school site specific protection plan, and something we should be so proud of because they adopted it and required now a COVID safety plan. And again, that's just expected to be updated, and you can update that just by reviewing this guidance document and making sure, seeing what you're going to change, what you might relax that was previously in your safety plan. The good news is you already have probably the most restrictive safety plan already done. So most schools will be in a position is just relaxing some of the requirements after they review what we're no longer considering applicable. All right. All right, we're going to keep going now because we're running short on time.
Yeah. Okay, if we can move forward here. Great.
All right, so I think as much as I talk about people needing to get vaccinated, it's something I'm just so proud of. We're near 94% of our population who are over 12 years old have at least received one dose. And we're nearing 90% of our population who are eligible for vaccine to be fully vaccinated. So something to be really proud of. And that's really a huge difference between where we were when we started last school year and where we are now. We have the opportunity for all staff in our schools to be fully vaccinated, the opportunity for the 12 and older to be fully vaccinated. While we're seeing an increase in hospitalizations, sadly, all the hospitalizations, not all, but 90+% are preventable by vaccination. So we're in a different space than where we were. Vaccinations work. We just need, but Delta is contagious, so we need to work with the populations that are unvaccinated to stop the spread of the Delta variant in our community. And so this just shows you the uptick in cases that we've seen. We reopened on June 15th and people relaxed, and they relaxed at the same time that the Delta variant began circulating. So it's not on a, it increased more than I thought. I thought we'd go up to the 30 mark, but what we've seen is that there are increasing breakthrough cases with the Delta variant because of where the mutation is, which is why we are now at that 50 new cases a day mark. Jump ahead. And this just shows you we led the state in identifying the Delta variant. Because of our high levels of vaccinations, it provided us the luxury to begin sequencing new cases. And so we identified the Delta variant in our community in April. And now you can see it is the single strain that is being sequenced in our county because it's just so contagious. It's just taken over the other variants. So you can jump ahead. And this, I think this is just really important, and just showing again what's different between January and August 3rd. And one of our roles is serving in the way of protecting our healthcare capacity and our healthcare system. And where we were at the same point last year with the same number of cases, we had 29 hospitalizations. Most people were not vaccinated at all on January 29th. Now we have only 10 hospitalizations. And sadly, 9 of the 10 that are currently in the hospital were preventable. They were among unvaccinated persons. So the message is to get vaccinated. Okay. And this is another slide to show the difference of your risk based on your vaccination status. So our case rate, if you are unvaccinated, is more than 30 new cases per 100,000 residents. And if you're vaccinated, it's less than 10. We are seeing breakthrough cases, and that's why but you'll see most of the transmission is happening among the unvaccinated social networks that are in our community. Jump ahead. Right, on to you.
Okay, so this provides some information about what's next. On August 17th and every month, there will be a public health update for the entire school community. So this would be a broad meeting that includes school leaders, parents, members of our community. So if you'll just mark August 17th, that will be a meeting at 1 o'clock, and then we scheduled ahead so that there'll be one on September 14th, October 12th, etc. So that's one thing to look at what's ahead. As Lisa said, we thank so much the staff members who have served as the public health liaisons. So there's a survey that's going out now to make sure that we have the right people from each of the schools identified. So some people may have left, new people taking on the role. And we will continue with weekly meetings with Dr. Santora at 4 o'clock. Those will start again. They've actually been happening all summer, but we'll start again on August 19th. We have scheduled meetings with labor leaders countywide, so that would be people representing all of our school employees. And we've scheduled 2 different sessions, knowing that it depends on what school someone's working at about when they start back. So there'll be one on the 13th at 3 o'clock, so that's next week at 3 o'clock, and one on the 16th at 11 o'clock. So we've scheduled those. All schools, as was mentioned by Dr. Santora, will need to update their school site specific plan or COVID plan. There's a template available, but please note, you already have the plan set. And so as you look at this, you'll really be looking at I think it's number 30 related to vaccination. So that's really the area that you'll be looking at. So if you'll be sure to take a look at that. Then the Rethinking Schools website will have all of this information available to you. And as we provide these updates, we are taping them, and then we will have them online along with the documents that support it. So the templates that are the PowerPoint along with the 30-point plan that you saw today will be available to you and to the entire community. So it usually takes less than like 4 hours, but we say within 24 hours it would be posted. Any questions that you may have, the Rethinking Schools Task Force is in play, and under rapid response at Marin Schools, you can reach out and there will be someone available to answer your questions, point you to the right direction if you need some additional data. And then in addition, there's the Public Health COVID Schools team, and that's the link. That's the link there. On the Marin County Office of Education website, hopefully as soon as tomorrow, when you go to that website, all the information related to this topic will show up as the very first place, the first thing you see on the website. So we're obviously planning ahead. I think don't underestimate the issues that we need to make sure we plan for. The number of new staff, right? Every school in our community will have new members joining their teams. And so it will be important that we don't just make assumptions that everybody was in play last year and already knows what all the protocols are along with the expectations. So the training piece is going to be very, very important for everyone. And then the reminder that there'll be new students that are joining our school community, but also little students who've not ever attended kindergarten before. And so it will be important that we go through all the different steps. So Ken, I think we have, let's see what time it is.
2 minutes.
Oh boy. So we have 2 minutes. Ken, any last questions that you see there that we've missed?
Sorry about that. I think the best thing we could do is to reiterate on number 31, because there continue to be a number of questions that is coming from public health. And until then, related to transportation, sports, band, and many of the other extracurriculars, guidance that's in place right now should continue to be followed. Is that correct?
Our transportation has been updated, correct? So students can go to school on buses at full capacity in the buses. They just need to be wearing masks, and we would recommend they lower the windows while they're going to school. We are waiting for guidance from the state around woodwind instruments and youth sports. And so our recommendation at this point is to follow what was in place at the end of the school year until we get further guidance from the state or the California Interscholastic Federation.
And then maybe the last one,
period. And then there's no risk, like people know the risk. So if you're seeing indoors in a small setting and people are not wearing masks, they should be wearing masks. There's gonna be higher risk of potential transmission. So again, that's why we first recommend anyone that can be vaccinated, should get vaccinated. That's your first level of protection. Always wearing that mask when possible, maximizing your time outdoors. If you're indoors, there's a higher risk. And if I'm a former flautist, so if you're playing a woodwind instrument in a small setting, you're gonna have higher risk for transmission of respiratory droplets. So now that we still have good weather, I'd say many of those activities just stay outdoors. And if you're indoors playing basketball, wear a mask.
Okay, so with that, thank you very much for joining us. This information will be available to the public within a few hours. August 17th will be the next opportunity for us to provide information to the broader community, and we look forward to opening the school year successfully. And in advance, hopefully everyone had a great time to step away, and we look forward to welcoming everyone back to school within the next couple of weeks. So bye, everybody. Thank you.